since you have the patient, physically there in the room, have them sign right away. So this way, now the billing isn't asking for 100 pages that are missing. Without these pages, it's an incomplete intake. And honestly, you guys shouldn't even see the patient if the intake is incomplete, or if you didn't even receive the chart with the intake. Okay, so we need to make sure that you're getting a chart, that you have an intake, and it is completed before you even do any exam on the patients. This will cause less issues. Soap notes. When we have temp doctors, they are to do soap notes. The staff is still, which I will speak with the therapist and receptionist as well. They are still to fill out the charts with what therapies are done, and then receptionists are to scan the soap notes into the G Drive and then leave the charts on your desk. So once you return, you guys are to complete all notes in Rapid Doc under Dr. Gotti. Okay? So if you notice that your staff is not doing the soap notes, maybe before you guys leave prior, you prep your office, you make sure that they have the soap notes with the charts, or they have them printed out on the side of them. So this way, now when you come back, you're not lost trying to figure out what patients were seen, what was done, because it makes it harder, because these temp doctors are basically only one-time doctors. They don't constantly come. Okay, I have a meeting next week with the receptionist, so I will also remind them as well, but I just want to let you guys know. Okay, we spoke probably maybe 2 meetings ago, and I let you guys know. You guys are like the office managers of the office that are physically there. I'm not in every office, and I can only watch so many cameras at one time. So if somebody's late, if somebody's not doing their task, if somebody doesn't show up and they don't text me, if you guys don't tell me within the first 10 minutes that the shift starts, I'm not gonna know. So I won't be able to see what's happening, and now this affects the staff, the office, and now you guys are short-staffed. So please let me know right away what's happening within the office. I do watch the cameras, but again, I can only watch so many cameras at one time, and we have almost 40 something staff that I'm trying to keep an eye on. So if somebody's missing, if somebody's late constantly, if somebody's not doing their task, if the office is dirty, I did send a message this morning, and I know Dr. A sent one last week to you guys about the office. Have your staff switch. When I'm normally in Hollywood, I try to go once or twice a week. I myself will start organizing, picking up a broom, start sweeping, start cleaning out a room or whatever it is. So if you see that your staff isn't doing it, let them know, hey, I need you guys to clean up the floor a little bit. It's a little messy. And you know what? If they don't listen to you, which they should respect you and listen to you, give me a call. I don't mind writing them up and letting them know this has to be done. It's a part of their everyday task. It's not an option for them. Okay, as well as you guys, if you see that the floor is dirty, grab the vacuum. If you guys don't have a vacuum, put it on your supply list. Liat will get a handheld vacuum. Literally just go around the office really quick, just so that it looks decent. Okay. MRIs. We are to send our scripts when we speak about every time we have a meeting right away, the first, second visit, even if there is no PIP information, even if there is no BI. We send one MRI if we do not have PIP or BI yet. If we do have BI of 10-20, then we can send 2 MRIs. If it's 25 and up BI, then we can go ahead and send 3 MRIs. Okay, so I know we have a lot of issue going on with Coral Springs where Robert was a little confused. Don't send 3 MRIs if the patient doesn't have PIP information yet or BI, because they're not going to get it done. And now the patient's upset because you inform them, hey, you're going to get 3 MRIs. I'm sending you to Coral Springs. And now the Coral Springs offices is letting them know they're only going to complete 1. Okay, any questions, any concerns, any issues regarding any of the topics that I spoke about? Anything anybody wants to add? No? Okay, Dr. A?
Do you guys have the spreadsheets for our patient log open on your computer to see that the patient that you expect to come are coming and that the staff is updating the spreadsheet? Okay. Is that yes for everybody on this chat right now? So I'm glad to see that. If you see that the staff did not update the patient's last visit because you recognize that the date is the wrong date, update the date and then also update the total visits. when sometimes I look at the spreadsheet, it looks like there are no patients in the office or very few because they're not up to date. But obviously, when I see your work, there are many more patients that are reflected on a spreadsheet that were updated. It's something that's very simple that I guess that sometimes the receptionists overlook, and you should remind them because you're their bosses. And when you recognize it, you can change it, and then also let them know that you're not supposed to change it. They're supposed to take care of it and update the spreadsheet. Now, on the spreadsheet, sometimes we have instructions such as which MRI do we send it to, which ortho group we send it to, either ours or a different one. Make sure that both you're aware of it, and then also remind the receptionist to follow through. So there'll be less or no confusion. Does it make sense? Good. Do you guys have any questions or concerns?
Yeah, I do.
Go ahead.
Barry. I just wanted to ask you about the referrals. When we send out our referrals on our first or second visit, many of the referrals are not getting, people aren't getting called, and they're coming back to us saying, I never got calls from these people. And then over time, some of it falls through the cracks, and they aren't getting the MRIs are never an issue. We always get those done right away. But it's the internal referrals, like for PT and for the ortho especially. PT, we've pretty much taken care of that one. But the orthopedic, I've had people come back, say, a few weeks and say, I haven't heard from anything. And they've had plenty of visits. They've had MRIs. They've had, plenty of time to have it done. And they're just not getting the orthopedics. And then I had a patient come the other day saying that they went to exam shoulder.
Dr. Angelini, you broke up.
Okay. Just recently, I had a patient that had the shoulder. It should have PRP in the shoulder. The orthopedist he went to, she said that PRP doesn't work, and so I'm not going to do it. I'd rather use, the steroid injections instead. I don't, as a physician, I don't appreciate that because I'm making a recommendation to the evaluator for something, and they're overriding it, saying that not only aren't they going to do it, but it doesn't work. That's, to me, that's not good practice. So
I agree. Do you know which practice it was?
That's not, the orthopedic? No, it was a female orthopedist, though, apparently.
Dr. A, that's probably BWA Broward Wellness,
I
because
assume
that's
so
where we
too.
send Shamrock to.
Correct. If later on you can write to Anja and myself the patient's name, we'll be able to see who saw that patient and to address it with that physician.
Okay. All right. I just, they're coming at some of the things because we're the first line of defense, as you know. People come in, they ask us questions, we give them the answers that they should have, and then to get overridden by people that they don't know undermines a lot of what we're doing.
100%.
As
I'm
you,
with you
as you
100%.
understand.
100%.
Okay, good. Thank you.
Of course. For your first comment about scheduling patients, Anja, we should look to see what's going on with Addie and Ali as far as scheduling the patients timely. They may do a good job, but we have to check with WBA if they're not.
So remember, Dr. A, for BWA, we're sending out after the 10th visit.
Correct.
So, okay. So, Dr. Angelini, just so you're aware too, we don't send out house until the 10th visit.
No, I understand that.
Okay.
But I'm having patients 3 months into their treatment telling me they don't have orthopedic tests. And that's just something that fell through the cracks. And the attorney is telling them to go to their orthopedist. I'd rather them go see the people that we know. And that's, they're way past 10 visits by then.
Okay, so if you can send me their names, because I do, the PM girls do keep a log of who they send out with notes that says whatever happened. Either the attorney said not to go or they were contacted and never answered. So if you can just send me the couple of names that you have so I can review them.
Yeah, it's more than a couple names, Angela. It's quite a few, actually.
Okay,
Um,
if you can have the girls send me a list.
Okay, no problem.
Thank
And
you.
then in the future, as it
Thank you.
happens, let us know right away, so we can address it right away.
Okay. Well, with the PT, I did. If you remember, we had that conversation
Yep.
because we have Shazad here now twice a week, and
And it's resolved,
it's
right?
just
Yes, it was taken care of. It was a misunderstanding with training.
Okay. The earlier we address it,
Okay,
the
no
sooner
problem.
we can have the results and the smoother it is. Period.
Sounds great. Thank you, sir.
Of course. Any other questions or concerns or an issue with a patient or patients? Any suggestions for improvement?
I have a
Um,
question.
Go ahead, Dr. Davila
Yeah.
or Dr.
Um,
Carla.
Okay, so for when a patient, I have two patients that have high BIs, right? But they don't have an attorney. They're treating because he's like, I don't want to get involved I don't want to hire an attorney. So they're treating, they have high BIs and they wanted to do injections. We cannot see him, right? In-house, we need to send it to Broward Wellness
Right.
Institute.
Correct. We have to send it to West Broward Associates or whatever the name is.
Okay.
But the fact that there is no attorney on file, you have to let them know that there isn't enough funds. There will be funds available if they want us. We can recommend an attorney to them. So then the
Okay.
attorney will be able to protect them, and then they will be able to go to
'Cause-
have an injection or other advanced procedures. And also explain to them, some people think that it's like in the movies that you have to go to court and the whole thing. Let them know that the attorney works in the background. They are minimally to really not involved, and it's not going to go to court. And it's not going to cost them. Also, it will allow them to do other procedures that the 10,000 BI wouldn't be enough even for a procedure there, let alone for therapy and procedure or procedures.
Okay.
And then see how they feel. Later on, if you can text me those names and what insurance they have and who's the BI, if you know the BI.
Yeah, we have for one, we have the BI and it's 100K. So that's what he's saying. He's like, I just want to get the injections, I try. One, I convinced him and got the attorney, but the other one, it's reluctant. Like I need somebody who can do the injections. But I was fucking because I have here Ali and Addie. So they told me that in-house we can't. That probably we need to send him out, and I just wanted to verify that.
Okay, so you
But
said
it's good.
one of them wanted to hire an attorney?
One of them did.
Who did they hire?
I have no idea. The patient got it himself. Somebody
Gotcha.
recommended, and he came and he gave me the information, and now we got it in. But the other one, it's very like.
Dr. Since the one has an attorney with a high BI, can't they be seen in Doral?
They can definitely be seen, and they can be seen either in Doral or or in Broward.
Okay.
However, we can set it up. Usually, if you can direct them that we'll recommend them attorneys, and I usually see if it's the BI is progressive. That's why I ask you who the BI is. I know what attorneys do very well against progressive. Progressive are actually very difficult. Or if it's State Farm, from our records, we see what attorneys have a better chance with State Farm. And then we can help them choose an attorney that has a better chance to get a higher settlement. Does it make sense?
Okay. Yeah. Okay. Noted.
Perfect.
Dr. Carla, you had a question?
Yes. My question is, well, it's not a question, it's just the PT patients and the ortho patients are having this problem. 2, 3 weeks pass by, and I keep on asking them every time, did they talk to PT Thomas or did they get the ortho appointment? And they say no one calls them. And I was wondering if, and then the front desk, Lily, says that she's having problems trying to help when she tries to help out the patients with the ortho location in Doral. So is there any way that the patients can have an extension, like you call back to mine and get an extension directly to the PT girl or the ortho girl making the appointments?
Yes, I think I gave it to Lily like 2 weeks ago.
And I heard her tell Melissa she's having problems talking to the girl making the appointments for the ortho and the Doral location. But I do know that patients are having problems with the PT as well. So
Okay, I'll
Just
speak
one-
to both sides and see what's going on.
okay, great.
And I'll text Lily the extension again.
So this is the extension the patient can use, right? Or just Lily?
Well, Lily would have to she would have to use the extension, but if they're calling into the office, then they would just either ask to speak to somebody in physical therapy or somebody in ortho pain management, and then it will transfer the call to the girls.
So I can tell the patient that, like if the patient says, it's 3 weeks into the PT and they haven't gotten a call about PT Thomas appointment, do I tell the patients, call back to my number and ask for this extension? Can I do that?
I don't know if I don't believe the AI works with extensions. They have to physically ask for the department. So they would
Okay,
have to physically ask for physical therapy or pain management, ortho.
Okay, so I'll tell the patient that. I'll tell them to call the number and ask specifically for PT department.
Okay, and then
Okay.
anybody that you do have an issue with, just have Lily send me a message. This way I can also be on top of it, so we're not waiting so long down the line.
Okay, great.
Okay. Dr. Maria, did you have a question? No? Okay. Anybody else have any concerns, issues, suggestions? Anything we want to go over? No? Dr.
Dr.
David?
Dave.
I have a question. Can you hear me?
Yes.
Um, New Year's and Christmas, are we same kind of deal with Thanksgiving, Thursday and Friday, or I don't even know what days they fall on, but are we doing New
So
Year's?
Christmas and New Year's this year falls Wednesday, Thursday. So we're closed Wednesday, Thursday, open Friday. So Monday, Tuesday, Friday, open that week.
Okay.
And we are planning a holiday party. Once we get it together, we will give everybody the details. Any other questions, issues, concerns? No? Okay, Dr. A, anything else?
No, guys, have a great rest of the day.
Okay, guys. And
Okay,
happy
good.
Thanksgiving if I don't speak with
Happy
you guys.
Thanksgiving.
One question, actually, before I have you guys on the phone. Tamarack will be open that Friday, after Thanksgiving. Does anybody else want to open and work? If not, it's okay. Just wondering. No? Okay. So, Coral Springs, and well, Dr. Schwartz isn't on here. Dr. David, if there's anybody who wants to treat on that Friday, they can go to Tamarack. Let them know they're open from 10. No, they're open, what, Dr. 12 to 7. No break. They're open from 12 to 7, no break. So if anybody would like to come in and do treatment, whoever's close to Tamarack, you're more than
Angela.
welcome to have your patients go over there.
We're gonna be open from 9 to 2.
Dr. A, you told me 12 to 7.
I lied to you. For the 9 to
Dr.
2.
A,
Well, you can come in for the rest of the day if you want.
okay, so 9 to 2. Let me fix it on my schedule then. Okay. Dr. A told me 12 to 7, Dr.
I'm
Angeles.
sorry.
No problem.
Okay, so 9 to 2, no break. If anybody, whoever's close by Tamarack wants to be treated that day. If not, we're closed Thursday and Friday. Have a wonderful Thanksgiving, and I will see you guys in a month.
Thank you.
Bye.
Bye, guys. Have a good one.